Welcome back to our Eyewitness News special report, Ebola Understanding the Epidemic. I'm Selena Ali. Before the break, we covered the basics of Ebola. What is it? How is it spread? Where it originated and listed the symptoms. Now we head back to our interview with senior lecturer and consultant microbiologist Chief Dr. Patrick Akpaka as he continues to shed light on this disease. What treatments are available for Ebola patients?
Right now, there are no definitive treatments, okay? But there is supportive treatment. First and foremost, when the person is having the fever and having the vomiting and the diarrhea, the person fluid and the electrolytes needs to be replenished. It needs to be given back, okay? And once that is being done, and then if there are pain with the fever and all that, giving the person some antipyretic or analgesics to soothe the pain, allowing the body to fight for itself. That's only how the person can survive, giving that supportive treatment. But definitive treatment, there's no antiviral treatment. Although some drugs have been put out there, like the ZMapp, they are now being given to people in order to boost their immune system, okay? So, but the essence is to boost the immune system. It wouldn't kill the bacteria, the virus. It will not. So it was try to protect the body, okay? Making sure that the virus is not overwhelming the system.
How is Ebola diagnosed? Is there a specific blood test that doctors would do?
Yes, yeah, the confirmation can be done through a blood test. Of course, the clinical picture raises a high index of suspicion. When somebody is stooling and having diarrhea per second with the fever, with the weakness, sometimes with the skin rash and all that, of course, and then with a history that the person has gone to Ebola endemic or outbreak area, you raise the flag that this person is suffering from Ebola. But in the lab, what we try to do in the lab, we use what we call ELISA method, enzyme-linked immunosorbent assay, to look for the antibody, okay? And once we see the antibody in that person, it confirms that the person had been exposed to it. That can easily be done in the lab from the blood, okay, or even from the diarrhea stool. But then also, there are some molecular tests that are done. And then in this molecular test, you're looking at the viral protein of the component of this virus. So we do a reverse transcription PCR to identify this protein, the antigen. And the one that is identified, that is a complete confirmation too that the person has the virus.
How long can Ebola survive outside the body?
Now, Ebola is a virus. It cannot survive on its own. It needs a cell to survive. That cell could be a bacteria, or that cell could be a cell in the human body, okay? Because it will use this human cell or any cell as a mechanism for survival to do its own respiration and all that of the cell, okay? So outside, there's a study that was done that's published in Canada where they experimentally looked at how these virus, whether it can survive in the lab. So they gave the different conditions and all that. In that study, I mean, almost up to 20 hours, they were able to survive. But their infectivity or the number keep decreasing, okay? So in general, they might not survive outside for too long, okay? But they can survive for some hours, all right? But they need the host cell in order to survive.
And how long can Ebola survive in a deceased body?
As long as that diseased body is still, because you see the diseased body you still have some cells that are still alive. Although the body is dead, but there are cells that are still there, okay? And then there are bacteria that is infecting the cells. The bacteria itself is even so for so long, as long as, I mean, I don't think that any study have been done to see, but it will survive in the dead body. Because even people have been infected through handling the carcasses of these animals and the corpse of humans.
How long after recovering from this disease can someone be removed from quarantine?
Once that person has been tested and there's none of this virus, antigen or the virus still in that person, then you can give a clear a beacon of health for the person to go and, and then maybe again, somebody who is infected and cured may not even be infectious to others, no.
Can a person who has survived Ebola be reinfected?
Yes, because there are several strains, there are several subtypes. He may have been infected by the Zaire strain initially, and then later on he's been infected by the Thai strain or by the Sudan strain. Yeah, it's possible, But the thing is that if the person exposes himself again to what caused him or her to get infected in the first place, it's possible, okay? Because it doesn't give you a lifelong immunity, no. But to that strain that the person was initially infected, yes, you cannot be reinfected again by that same strain, okay? Because you now have received or have developed antibodies against it. But for one other strains, yes, so it's possible.
Now, there have been reports of, or there have been certain news reports actually, where articles are claiming that Ebola is airborne. Has it become airborne, and could it become airborne?
You cannot acquire the virus through breathing the air, okay? So it's not airborne. But if, for example, you came in contact with infected fluid, you touched that fluid, or you touched that person, or you touched that dead body with your bare hand, we are fond of rubbing our face, rubbing our nose, rubbing our mouth, so you can get infected that way.
We'll continue with our Eyewitness News special, Ebola, Understanding the Epidemic, after this.